Hi, my name is Stacy Borello. I'm a member of Healthcare for All Y'all in the Triangle region of North Carolina, and I am sharing my healthcare story today with the hopes to inspire more of you to share your healthcare stories because we have very important work to do. We need a single payer system. We need Medicare for all because healthcare justice means that everyone gets served regardless of income. Everyone gets to lead a healthy, happy life where their medical needs and mental health needs are attended to, where people aren't left bankrupt or even addicted to drugs or committing suicide because they're not able to access the care that they need. It's not a compassionate way to live, and there's a lot of misinformation out there. There are opponents of Medicare for All, people who will have to pay a small portion of their immense fortunes to help finance this program, are really rallying against it, and they're telling people lies like Medicare for All will take away your freedom. That is completely untrue. The backbone of Medicare for All is we pay a very small amount in payroll taxes, which is a drastic reduction in price over what we pay now in the form of premiums, deductibles, co-pays, and the prices for some very expensive prescription medications that people need to live. So Medicare for All, it actually means more freedom. It means being able to get the healthcare services that you need and not worry about whether you will be able to afford what you need to live a happy, healthy, productive life, and not worry whether your children will be able to get the services they need either. Employer-sponsored plans are not freedom. I have an employer-sponsored plan. Well, I know that I am technically one of the more lucky ones that I have the ability to access this. I don't believe that ability to access healthcare should be based on income, and that's why I'm fighting for healthcare for everyone. But let me tell you a little bit about my healthcare story and my healthcare plan. We have a $3,500 family deductible, and so this means that on top of the monthly premiums we pay out of the paycheck, this is my husband's employer, that he pays out of his paycheck for his family plan, we're still stuck paying 100% of the cost of care and medications until we reach that $3,500 deductible. So really, we're just shelling money out all of the time. Those premium prices and those deductibles have inched up or been continuously raised over the 10 or 12 years we've had this plan. And so some years we have met that deductible and then finally get this relief of this last few months of the year where we get to actually use our health care in a more affordable way, where we can go see a counselor for around a $20 coinsurance or get medication at a lower rate than it would be before we met our deductible. People shouldn't have to live like this. People shouldn't have to pinch their pennies or skip needed care or only get the care that they need and that they deserve in this small window of time once they've met their deductible and before January 1 hits. So our situation, even though we've met our deductible, and I talked about this relief that we have the ability to have more affordable health care now, we still are facing roadblocks, which is not representative of freedom in healthcare choices. One example is my younger son needs speech therapy. He's speech delayed. Well, our insurance only covers 30 visits per year. There's 52 weeks in a year, so that means 22 of those weeks he has to go without speech therapy. He has to wait to get better at talking because our insurance won't cover the services that he needs. We would have to pay, even though we've met our deductible, we'd have to pay for his speech therapy 30-minute session out of pocket at a rate of $75 for 30 minutes, which with the other things we have going on right now in our family and our healthcare needs is not really affordable for us. So that's really upsetting to be a mother who has a child who needs care and who you're not really able to pay for it because our employer-sponsored plan is not covering the amount of services that he needs. That's not the only trouble we're dealing with our employer-sponsored plan. My son, my older son, has a condition that he needs an expensive medication for. He was prescribed this new medication that should help him. We're still waiting to see. A few weeks ago, and immediately once the provider sent in the prescription, our insurance denied coverage for it, and then it was appealed and they denied the appeal. And finally, I had a provider who was very diligent and willing to work through this very difficult process with lots of roadblocks in it. She had a peer-to-peer review and finally got this medication approved under our coverage, so we were able to afford it at our 20% coinsurance rate now that we've met our deductible this year. That delay from the insurance company cost about a lot of time and stress and effort to get it worked out. A lot of an hour and a half of phone call. I had to wait mostly on hold for one day when asking them to approve this medication. He had to wait 2 weeks to take it from the date that the prescriber prescribed it because of these insurance hurdles, which again do not represent freedom in any way, shape, or form. The other thing that we're bracing for is it's about halfway through November now, and we have this December 31 looming deadline to access a more affordable care at the 20% coinsurance rate. Once this arbitrary calendar date rolls around and our deductible resets, we're again stuck paying high premiums and paying for all of our care, services, and medication out of pocket once again. So that leaves us in the situation where we're going to have to decide which our family is in counseling, and some members of it at least, and we're going to have to decide which counselors we can't afford to see anymore. We're going to have to figure out something for this expensive medication. The Good RX plan, if you don't know about that, it's like bypasses insurance and gives a discount on some medications, so you might want to check that out if you're finding that your insurance cost for your medication is really high. Check the Good RX prices. We actually found that our insurance contracted rate for a lot of medications is about double the price of what you can get the medication for through GoodRx without using your insurance, which is ridiculous for people who are insured to have to pay higher prices than an out-of-pocket cost. I mean, it's really a system that is ripping us off. So I think I got through most of what I wanted to say about my healthcare story. The overall picture, if you read the text in this post, the overall picture for American families is bleak and getting bleaker. The cost of healthcare coverage in the U.S. is now about $20,000 per individual. This is according to an annual survey of employers. Employers are covering the majority of that cost, but according to the survey, employees are still paying about $6,000 per year for a family plan, and that does not include any other out-of-pocket costs like co-payments and meeting their deductible and their prescription costs and things like that. That's just the premiums. Because of this rising healthcare costs, many less people are enrolled in a health insurance plan than about 20 years ago. Americans under age 65 fewer Americans under age 65 had employer coverage in 2017 than in 1999, despite the fact that the U.S. economy actually employs 17 million more people now than in 1999. Employees' costs for health care are rising more quickly than their wages or the overall economy-wide prices, and the working poor are, of course, the most particularly hard hit. We have to fight for health care as a right. We have to stop the misinformation campaigns that is trying to trick people into believing that being able to access the health care that they need without huge out-of-pocket costs is somehow losing freedom. It is not losing freedom. We need to share our stories. We need to encourage others to stand up and make sure that we all have access to the health care that is our right to have. Thank you.